Clinical Decision Making. 1. N. Cooper Al Cracknell. Introduction to the Problem of Diagnostic Error. 2. Clinical Reasoning. Definitions. 2. History and Physical Examination. 2. Use and Interpretation of Diagnostic Tests. 3. Normal Values. 3. Factors other than disease that influence test results. 4. Operating Characteristics. 4. Sensitivity and Specificity. 4. Prevalence of disease. 5. Dealing with uncertainty. 5. Problem representation. 5. Cognitive biases. 6. Type 1 and Type 2 thinking. 6. Common cognitive biases in medicine. 7. Thinking about thinking. 7. Human factors. 7. Shared decision making. 9. Patient-centered evidence-based medicine. 9. Effective team communication. 9. Using clinical prediction rules and other decision aids. 9. Reducing errors in clinical decision making. 9. Deliberate practice. 9. Cognitive debugging strategies. 9. Clinical decision making. Putting it all together. 10. Answers to problems. 11. 2. Clinical decision making. Introduction. A great deal of knowledge and skill is required to practice as a doctor. Physicians in the 21st century need to have a comprehensive knowledge of basic and clinical sciences, have good communication skills, be able to perform procedures, work effectively in a team, and demonstrate professional and ethical behavior. But how doctors think, reason, and make decisions is arguably their most critical skill. Knowledge is necessary, but not sufficient on its own for good performance and safe care. This chapter describes the principles of clinical decision making, also known as clinical reasoning. The problem of diagnostic error. It is estimated that diagnosis is wrong 10%-15% of the time in specialties such as emergency medicine, internal medicine, and general practice. Diagnostic error is associated with greater morbidity than other types of medical error, and the majority is considered to be preventable. For every diagnostic error there are usually several root causes. Studies identify 3 main categories, shown in box 1.1. However, human cognitive error appears to play a significant role in the majority of diagnostic errors. Human cognitive error occurs when the clinician has all the information necessary to make the diagnosis, but then makes the wrong diagnosis. Why does this happen? 3 main reasons have been identified: knowledge gaps, misinterpretation of diagnostic tests, cognitive biases. Examples of errors in these 3 categories are shown in box 1.2. Clearly, clinical knowledge is required for sound clinical reasoning, and an incomplete knowledge base or inadequate experience can lead to diagnostic error. However, this chapter will focus on some other aspects of knowledge that are important for effective clinical reasoning, including use and interpretation of diagnostic tests, cognitive biases, and human factors. Clinical reasoning. Definitions. Clinical reasoning describes the thinking and decision-making processes associated with clinical practice. Our understanding of clinical reasoning derives from the fields of education, cognitive psychology, studies of expertise, and the diagnostic error and health systems literature. Clinical reasoning can be conceptualized as a process with different components, each requiring specific knowledge, skills, and behaviors. The UK Clinical Reasoning in Medical Education Group, see further information, broadly lists these components as history and physical examination, use and interpretation of diagnostic tests, problem identification, and management, shared decision making. Not all of these components are necessary for effective clinical reasoning, and they do not necessarily happen in this order. They also occur in contexts that impact on decision making, which will be explored later. Underpinning all of this is formal and experiential knowledge of basic sciences and clinical medicine. The knowledge required for effective clinical reasoning includes factual knowledge, but also conceptual knowledge, how things tie together, as well as procedural knowledge, how to do something, what techniques to use, plus an awareness of and an ability to think about one's own thinking, also known as metacognitive knowledge. This is where an understanding of cognitive biases and human factors is important. Fig. 1.1 shows the key components involved in clinical reasoning that will be explored further in this chapter. History and physical examination. Even with major advances